For registered nurses and CNAs at Lincoln. Patient safety, hypoglycemia help for patients during clinic visits. It's important to mention hypoglycemia to patients on most non-insulin anti-hyperglycemic therapies as well as insulin. Certainly, metformin alone does not cause hypo. But a recent study demonstrated that the majority of patients with diabetes requiring hospitalization for severe hypoglycemia were those with type 2 diabetes. 4 deaths occurred in this group, a strong association between severe hypoglycemia and combined metformin and sulfonylurea therapy. Hypoglycemia can be dangerous. It's certainly dreaded by patients. And patient explanations are really a legal mandate. We just can't have a legal leg to stand on if we said we didn't tell patients about this. And then we document that we talked about hypoglycemia. So it's always been and still remains the rule of 15. That means 15 grams of carbs, about 15, and about 15 minutes to feel mostly back to normal. So that 15 grams or about that is in 1/2 cup of any fruit juice or regular non-diet soda. It doesn't have to just be orange juice. It doesn't have to be any clear liquids. Any 1/2 cup of any fruit juice or regular non-diet soda. You can get it other ways too. A tablespoon of sugar, honey, jelly, cake icing. It's about 15 grams. You can use glucose tablets or 1 tube of glucose gel or about 15 grams of a known amount of an easily swallowed candy. So you would read the label and see what's in Sweeties or Sweet Tarts or something and know exactly. Often children with diabetes are given that rather than some sort of adult-looking thing. But you have to know what you're doing, not just anything. Follow-up treatment, longer than 1 hour, that you would have something else. Now, some common treatments are not best practice. So let's look at some of these. So what about that little piece of hard candy? Well, it's not fast, just not very effective. I mean, would you suck on it for 10 minutes? And, I've had patients break a tooth. They've choked. I wouldn't drive around hunting for something else if that was on you, but as we say here at the bottom, be prepared with ready-to-go and effective treatment. Don't be without it. How about that chocolate candy bar? Well, again, it's not very fast and not real soon because there's a lot of fat in there and things that slow it down. The nuts and different components in the candy, the chocolate. So, again, you could use it, but better to be prepared. Ice cream would be the same thing. There's other components. And you have to know how much of what ice cream. Peanut butter and crackers would be exactly the same thing. It's not going to work all that fast, but it could. Diet said, no, nothing in there. Lie down and rest, gracious. No, but I've heard that. Now, over-treatment with large amounts of food and fluids is a very common problem. So let's look at that. To remember that hypoglycemia symptoms can include extreme hunger, shaking, confusion, and past experience demonstrated to the patient that he felt better after treating with carbs. Way too many carbs. Acknowledge that it's understandable why people overtreat. We understand that. It's time to stop, and it's just a bad idea, and move on to the next subject. Explain that the correct number of carbs, at about 15, will bring up the blood sugar as fast as too many carbs. More carbs do not work faster. Does not work. The body doesn't work that way. It's going to come up from the proper amount and just keep going higher. Overtreatment only drives the sugar very high and makes everything worse. So you go from low to from high, low, back and forth. Low, high, so on, which makes you feel worse. Forming a better habit for treatment is not easy, but it can be done. So encourage you, give it a try. They're going to find out they feel a lot better. So safety. If you think your sugar is low, test and treat. If your meter's not available, go ahead and treat. So low sugar removes energy from the brain and thinking suffers. Patients have been known to skip treatment because they were not near their meter, then with catastrophic results. If not low, if the blood sugar is not low, treatment will not raise the blood glucose dangerously. The proper treatment will not. So it's better to treat if you think you're low, even if not low. But if this situation happens again, be sure that your meter is with you for the time being to find out what's going on. Now, when you need to teach glucagon emergency kit, particularly with type 1, it's not real user-friendly because it must be reconstituted and you need to practice beforehand with an expired product. If your loved one's on the floor seizing from low blood sugar, it's very hard to read those complicated instructions and reconstitute it. But it can be done. Ahead of time teaching is important. So if you were to describe to your spouse what we talked about today, about that low sugar, what would you say? And teach back is more productive than got any questions. Thank you.